Hi, I'm Nicole Stapp, one of the nurse practitioners here at Allure Medical Spa. Today we are going to do a male pellet insert. We have a high percentage of male patients that do HRT with us. We are using testosterone pellets, and this is shown to be beneficial to help combat fatigue, depression, low testosterone, or low libido, low sex drive, and also help with weight loss, as well as it being cardioprotective for these patients. So our patient today here is going to get a 1,500 milligram dose of testosterone pellets. The dose is a pretty standard dose based on your weight, 10 milligrams per pound. So this individual today is getting 1,500 milligrams. We're going to first start by numbing the area. We already did one side, so we're going to do this right side now. And this will anesthetize the area when I insert to numb the rest of the area. We're going to now numb the track for the direction of our pellet insert. Doing okay?
Yes.
All right. Now that he is all numb and we have cleaned the area, we are going to start to insert the pellets. I just want to reiterate the benefits of these pellets. Again, it helps with fatigue, mental clarity, depression, maybe giving you more of an edge or drive to actually get you to work out. And it can also help with weight loss and reduce your risk of heart attack by 50%, which is a great benefit for these males. So first I'm going to make an incision. Now we're going to split his dose into two sides so he's not as sore just on one side. We use our little tool here called a trocar. I'm going to kind of tunnel the area. You doing okay?
Yes.
Okay. Show you that pellet here. This is the pellet that we will be inserting. Now that's a 200 milligram pellet, so the diameter is a little bit bigger. And now I'm just going to angle this a little bit differently to do the next insert. Okay, so this concludes our male pellet insert. And I'd just like to ask our patient here if he had felt anything during this procedure. How was it on a scale of 1 to 10?
It was painless.
Perfect.
Very easy.